The structure and function of the fall committee include the Director of Nursing, Assistant Director of Nursing, Clinical Nurse Manager 2, a senior nurse or staff nurse from each ward, a healthcare assistant from each ward, and physiotherapists. The physiotherapists will act as the coordinator for the fall committee. The committee will review the falls report from the previous month and extract lessons learned. A falls audit will be conducted by the physiotherapist and nurse every 4 months. The falls policy will be reviewed annually or as necessary by the physiotherapist and CNM. Every month, Nelson and physiotherapist will present the fall data at the monthly quality QSSI meeting, while the health and safety advisor will monitor the fall data through incident reports. Upon admission, physiotherapist will carry out a moving and handling evaluation on the admission day, fill out the designated LSU assessment form, and provide hip savers, anti-slip socks, and walking aids. Post-admission, physiotherapist will implement personalized mobility and balance exercises on a daily basis, arrange weekly group exercise sessions for LSU and daycare residents, engage residents in various projects, review walking aids on a monthly basis, facilitate fall committee meetings, and procure physiotherapy equipment as necessary. Upon post-fall, the physiotherapist will perform an assessment and management review after a fall, conduct a moving and handling evaluation and falls mitigation action plan in collaboration with the nurse, refer to occupational therapist when required, and consult with the doctor regarding falls and fracture treatment. In 2023, there were a total of 109 general fall incidents. We have identified that 50 residents experienced falls from their beds, which is a critical issue that needs to be addressed. The reason for this is that when residents who are confined to bed or wheelchair roll off the bed onto a crash mat, it is classified as a fall, and such incidents also occur due to unsuitable bed height. Following an analysis of the underlying causes of fall incidents, we have decided to implement quality service improvement initiatives projects. The Quality Improvement Study on Optimizing Bed Height is a project that aims to increase awareness among healthcare staff about the significance of maintaining optimal patient bed height to prevent falls and fall injuries to reduce hospital admissions. The Patient Safety Strategy 2019 to 2024 was the benchmark for this study. The parameters examined in the article published by Elsevier B., which analyzed the influence of hospital bed height on kinematic factors associated with patient falls during egress in 2015, were utilized as standard intervention methods. Residents aged 65 or over falling out of bed between January and June 2022 were used as a pretest measure. By maintaining a hip or knee angle just above 90 degrees, keeping the residents' feet flat on the floor, and ensuring that they can easily transition from sitting to standing and vice versa, the nurse and physiotherapist assessed the residents' mobility and determined the height of the residents' bed. An illustration of the ideal height is displayed on a poster that hangs on the wall above the headboard of the bed. Nurses would visit each resident's room each day to ensure that the beds were in the ideal position and record this information in the monitoring system. The data obtained during the 6 months of intervention, July to December 2022, was compared with the pretest results. When results from a 6-month intervention period, July to December 2022, were compared to those from a 6-month pre-intervention phase, January to June 2022, with 14 bed falls, there was a 50% decrease in bed falls. The study revealed that older adults who had bed falls and trouble getting out of their beds had lower fall rates, suggesting that stakeholders' knowledge of the ideal bed height had increased. Pedal to Beat, a promising music-enhanced cycling therapy for elderly residents. This quality improvement initiative aims to enhance well-being and engagement, explores the integration of music into cycling exercises to promote physical and mental well-being among elderly residents at Bellvilla Community Unit. The project seeks to improve participation in exercise, cardiovascular health, mood, and cognitive function by pairing cycling sessions with engaging music, including familiar tunes and nature documentaries. Participants, selected based on mobility and health criteria, engage in group cycling sessions 2 to 3 times weekly, with varying intensity tailored to their capabilities. Progress is monitored through simple tracking methods and participant feedback, emphasizing inclusivity and adaptability. A comparative analysis highlighted significant improvements. Average exercise durations increased from 15 minutes in 2023 without music to 45 minutes in 2024 with music, illustrating music's motivational impact. The study references literature on music's ability to elevate mood, distract from discomfort, and enhance exercise intensity, providing a strong theoretical foundation. Challenges such as resident participation and hearing impairments are addressed through gradual implementation and volume adjustments. The project demonstrates how music can transform exercise into a social and enjoyable activity, making physical activity accessible and engaging for elderly individuals. This innovative approach underscores the potential of music-enhanced therapies in improving health outcomes and quality of life in elderly care settings. The aim is to provide floor beds equipped with high safety mats to reduce the risk of falls for residents who have experienced a fall from their beds onto crash mattresses. From a technical standpoint, if a resident falls from the bed onto the crash mat, it is categorized as a fall. We attempted to implement a floor bed alongside a high safety mat, both set at the same height, allowing residents to roll onto the high safety mat from the floor without it being classified as a fall, but rather as a roll. The floor bed is economically viable. Over a patient's stay in nursing homes, they typically start on profile beds when mobile, transition to low entry beds, and eventually shift to floor beds when they become bedbound. Simply providing residents with floor beds and adjusting bed heights according to their mobility has been demonstrated to be cost efficient as per our findings. In 2023, 50 residents experienced falls from their beds, but following the intervention, the number of falls dropped to 17, reflecting a 66% decrease in bed-related falls. To summarize, Bellvilla Community Unit recorded a total of 109 falls in 2023, and due to the interventions, there were 89 falls in 2024, which indicates an 18.35% reduction in falls. The key takeaways are: optimizing bed height and erecting poster to indicate bed height helps in reducing risk of fall. Playing resident preferred music during exercise in enhancing duration of physical activity. Floor beds and high safety mats are more effective than profile beds and low entry beds. Future plans are to continue monitoring fall data and explore further improvements to patient safety.